This is Jen here with Status Quo. We're at the Save Hahnemann rally, Medicare for All rally that Bernie Sanders will be at in just moments away. And I'm here with, your name's Dave?
Yeah.
Tell us a little bit about your sign, healthcare, not wealthcare, solidarity with PASNAP, which I believe is the nurses union.
Yeah, it's the nurses union. So my wife and I, a friend of ours, has been working here for 20 years. And she's going to lose her job, obviously, if they close the hospital. We don't want that to happen. Last Thursday, we were out here for the rally with Nina Turner, with the kids and everything, and the kids started acting up, so we had to go home. But we just wanted to make sure our voice was heard, so I brought our same sign back out because it's more important that people in this community have health care and that the jobs and whatnot are taken care of. It's over 800 union jobs here. I'm in the Teamsters Union. I understand how that works. The union has to stand up, fight back. The city and state have to back them up. And we're glad Bernie and his organization are here backing up as well, because Medicare for All could help, honestly. But if we can't get it soon enough to save this hospital, then the city and state need to preserve it long enough to make sure it keeps going. Between the city and the state and Drexel all not wanting it to close, somebody ought to put up funding so that the nurses can keep it open themselves, honestly. I think Bernie was just co-sponsoring legislation to fund worker co-ops with the federal government, and that's the ideal situation, honestly. So if we could get some funding for that so that the people who are actually doing all the work here can keep it open themselves and our friend can keep her job, that would be fantastic, because like I said, it's more important that the community have health care than that somebody over in, I think, doesn't the capitalist that owns this place live in California or something?
Yeah, California. Jesse Friedman, I believe his name is a private equity guy who bought up Hahnemann, I believe in 2018. And a lot of people think that was done for the specific idea of running Hahnemann to the ground. Do you think that's why he bought Hahnemann, to sell off the land, sell off the property?
Yeah, absolutely. He did the same thing that the Sears CEO did, where he split off the real estate from the rest of the business, and I believe that CEO is being prosecuted at the moment. So if that really is what he was doing, maybe we should look into that. But obviously, I came over from Jersey, where I live. I work in the city, but I live in Jersey. And driving in, trying to find parking around here, this neighborhood has changed a lot in the past decade or so with gentrification, and there's it's getting completely ridiculous. That's obviously speculating to open up more of these condos everywhere. Obviously, this is a better structure than some of this crap that's been getting rush built by shoddy construction lately. But we don't want it used for condos. We want it used to keep the community provided with good, solid health care and good union jobs.
You speak a lot about the community and how it's changing, gentrification. This is prime real estate. I mean, I'm sure there are people salivating at what they could do with this. Meanwhile, there are more than 2,500 jobs on the line. A lot of residents don't know what they're going to do. Medical residents and actual residents. Over 2/3 are minority population. Many are low income. If Hahnemann has to leave, how does that impact the people who come here for health care?
I mean, it's going to deprive them of health care for all intents and purposes. There's not a lot of hospitals with these kind of services in a reasonable distance from here. Even if the neighborhood is changing to where people may have more ability to access private services, be able to travel further for services, the people who have been in the community the longest should have the right to have the health care that they've always had. And if it's something where people are coming into the community and they want change, they need to invest in what's already here rather than trying to change it over into something else.
What are your thoughts on Medicare for All? Because not only is Bernie Sanders going to be talking about saving Hahnemann and the very important reasons for that, but also how Medicare for All could save hospitals like Hahnemann. What are your thoughts on that?
Absolutely. One of the main things with Medicare for All is that I was listening to a program Eugene Perrier was doing recently, where he was talking about the lie that they're telling, the right wing is spreading about Medicare not being sufficient funding for hospitals, that it actually, the Medicare for All bill doesn't necessarily tie it to the current funding levels, first of all. Second of all, it would be increasing Medicaid to Medicare levels of spending so that the providers would actually be receiving more money from Medicaid patients, which would specifically help in communities like this one where many patients are on Medicaid. and need that service. Like my family was on Medicaid, and when Trump got elected, I had to go work nights in a warehouse. I work 14 hours every night, trying to make sure my family has Trump-proof health care as long as he's in office. Thanks to the Teamsters, we have that, but not everyone has the ability to do that, and people shouldn't have to. People should be able to have the health care that they need regardless of their income level and their ability to do ridiculous jobs.
And today, Joe Biden came out with a plan to save and expand the ACA. Does that go far enough? Would that help a hospital like Hahnemann or the people around it, or is it just another kind of centrist policy that doesn't go far enough?
I think it goes far enough for the people that Joe Biden is concerned about. Obviously, with what he was saying about busing and things of that nature, he's not particularly concerned about the community that this is in. We're in the fringe of what used to be called North Philadelphia, whatever the real estate developers are trying to call it now, I'm not sure. And obviously that's not a community that Joe Biden particularly cares about, given his support for busing in this lack of support for busing in this particular area, which would have solved a lot of the entrenched issues with institutional racism that have developed with the school district and whatnot over the years. So I think that for the people that he's concerned about in Delaware, in the suburbs, people like me that already have good health care, I'm sure that's fine. But for people like I was before I got this job, people like my friends and family, people like the patients here at Hahnemann, I really don't think that's enough. I think that we need secure, permanent health care that's for everyone, regardless of their income or job status.
Very good. And any last words, any last thoughts you want to leave us with?
I just hope that Bernie can really push this struggle even farther, both here in Hahnemann and around the country, so that we can keep places like Hahnemann open, so that we can have good, strong union jobs, and that the state and the city and Drexel, if they really wanted to stay open that badly, will follow Bernie's lead in stepping in to support, and not just support with words, but to support financially, so that the nurses and doctors can keep it open themselves as a co-op.
Hope you enjoyed that last video. Hop on over to statusquo.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statusquo.com/join. And remember, join our email list so we can grow the revolution with you.